Good evening, everyone. Myself, Dr. SANCHARI Chakraborty, and I am a secondary DNB resident in Sri Shankaradeva Netralaya, Assam. I have no financial interest, and today I'll be presenting a case on a intraocular metastasis in a known case of diffuse large B-cell lymphoma of abdomen. This 69-year-old lady who presented to us, who was earlier diagnosed with abdominal diffuse large B-cell lymphoma for last 2 years, and she had undergone 6 cycles of chemotherapy. She also suffers from comorbidity of hypertension and type 2 diabetes mellitus. She presented mainly with loss of vision, pain, watering, and headache. On examination, we found out that the right eye vision is very poor, only perception of light is present, while the inaccuracy in the perception of the light. She had a history of cataract surgery 4 years ago, so both eyes are pseudophakic. On anterior chamber examination via slit lamp, we found out that there is grade 1 hyphema and grade 2 anterior cells and grade 2 anterior cells flare. We did an IOP checkup via Goldman applanation tonometry, and it came out to be around 42 millimeter of mercury in the right eye. The left eye findings were normal. Following the investigation, we found out in the USG-B scan, there is a retinal detachment, and we can also see that there is an increase in the retinochoroidal thickness. We did an MRI, and we can see there is a choroidal mass which shows, along with it shows on T2 enhance, we can see there is a hypointense mass and there is an RD as well. Now, the patient already underwent a PET CT scan which showed multiple upticks of FDG in the various parts of the body, including in the cervical lymph nodes. Now, to correlate our suspicion that the patient might have undergone any kind of ocular metastasis, we did an AC tap, and it revealed that malignant monomorphic lymphomatous cells consistent with the intraocular space. Thus, we made an urgent radio-oncologist referral for further management, since the patient is already in a debilitating state and she needs further management in the radio-oncology department. So lymphomas of the eye are uncommon and account only 1% of non-Hodgkin lymphoma and less than 1% of all intraocular tumors. Systemic lymphomas usually metastasize into eye via hematogenous spread and compromise only 17% of all intraocular lymphomas. Ocular involvement of systemic lymphoma usually presents as vitritis and posterior uveitis with distinct subretinal infiltrates. Occasionally, anterior uveitis and optic nerve involvement is also present. Definite diagnosis of this condition requires detection of the malignant lymphocytes in the ocular tissue or fluid specimens. In this case, a cytological examination of the aqueous sample revealed large pleomorphic lymphoid cells with irregular hyperchromatic nuclei, prominent nucleoli, high nuclear and cytoplasmic ratio, prominent mitotic activity, which are consistent with the diagnosis of intraocular large B-cell non-Hodgkin lymphoma. On discussion, we can say that diffuse large B-cell lymphoma is a fast-growing, aggressive, and the most common subtype of non-Hodgkin lymphoma, comprising 20 to 40% of all the lymphomas. Systemic lymphomas have a propensity to involve the uveal tissue secondarily and can masquerade itself as a panuveitis and elude the diagnosis. In our case as well, the secondary glaucoma is also common occurrence in patients of intraocular lymphoma with uveal tissue involvement, probably due to the tumor infiltration directly to the angle or secondary to the angle neovascularization. So in conclusion, we can say this case illustrates that systemic non-Hodgkin lymphoma may also recur as long as 2 years later, such in our case as an intraocular process. This presentation also highlights that life-threatening malignant lymphoma may masquerade as anterior segment ocular inflammation or neovascular glaucoma and rarely hyphema. A high index of suspicion is mandatory, and we should be aware of this presentation, especially in patients with the history of lymphoma. The key to diagnosis is identification of atypical lymphoid cells in the ocular tissue or fluid supplements. Thank you.